Hi, I'm Jerry. This is my hometown, Hazard. As a woman living in Perry County, Kentucky, my life expectancy is lower than almost every woman in the United States. You'd think that'd make me worry, or at least make me mad. But the fact is, people around here, we aren't really worried or mad because we're told we don't matter. Appalachia is a region long impacted by others who have held power over those who live here. This is a health equity issue, loss of hope, loss of agency, loss of power. People in this region gave up their coal and their land to power the Industrial Revolution. When coal companies converged on us 100 years ago, families in mining camps were paid in scrip, and they returned that to the companies to pay for their housing and their food and other things that they need. Then came the war on poverty, which kept people from starving, and that's good as long as they were willing to follow the rules about what they ate and where they lived. And most recently, the pharmaceutical companies have arrived to take advantage of our hurting workforce. Now we have an opioid epidemic. The emotional, mental, and physical impacts of this history on Appalachian people is not simply about economics or poor health. It's about a loss of control and disempowerment. Our proposed project seeks to change this paradigm. The Foundation for Appalachian Kentucky proposes an approach that's going to put USA LEAP directly into the hands of local people so they can use it to make a difference in their lives and in our communities. More than 10 years ago, people created the foundation to address our overall poor health by reclaiming the power of community. Our premise is that if we focus on building communities of people with the capacity to create solutions and leverage resources, that the money won't be the hardest obstacle. Our approach is to combine data with local wisdom to create some indicators that indicators of a healthy community that we can use to address a variety of issues, maybe housing, education, employment, transportation, all things that contribute to improved health equity for the residents of this region. We've built a strong network of local boards and citizen groups across multiple counties in the coal fields of southeastern Kentucky. These community leaders will use USA LEAP and other data to design, develop, and research a measuring system for our community work. Armed with the data and tools that we need, we'll have clear and honest information about past trends and current realities. Understanding trends and realities will be what help focus local work on projects that address health-related challenges, both from a program and a collective regional approach. We've already embarked on an initial feasibility plan. Coupled with funding that continues to grow in our foundation, we'll be able to take the action we need as communities. This project will build local capacity to use the resources we already have to leverage more resources that will increase the impact of our efforts in addressing the indicators of community health. Data will be the guide that's going to steer local wisdom and results, moving people to make changes into local hands. Our citizens will clarify key issues and challenges, instill the values in our civic leadership that are going to prioritize spending towards specific initiatives and policy changes. This is what's going to have a real impact on our quality of life and our life expectancy. The Foundation for Appalachian Kentucky is a different kind of philanthropy, one that seeks to engage our region's inventiveness and focus its capabilities, put control into the hands of local people. We're cultivating the will and the imagination and the know-how of caring and concerned people to address contradictions between the ideals we hold and the disappointing realities that we face. Using the USA LEAP data to build indicators of success is what's going to empower local people to make a difference in our local communities.